My name is Jose Osorio. I'm a director of cardiac electrophysiology for HCA Florida. Cardioversion is a quick procedure performed in the hospital that after we put you to sleep, typically for just 3 to 5 minutes, we put patches in your chest and back, and electricity is delivered to stop and quickly resynchronize the rhythm of your heart and restore normal rhythm. A cardioversion will stop an episode of atrial fibrillation, but does not prevent another episode from happening. So typically when you undergo a cardioversion, we're also going to start medications to prevent future spells of atrial fibrillation. Oftentimes, cardioversions may be used because you're having a severe spell and you're highly symptomatic, so we want to stop that episode right away. But in some patients, we also use it to see if getting you back into normal rhythm is going to make you feel better. So let's say you see a physician and you say, I have fatigue, which is a complaint that many conditions may cause, and you are in atrial fibrillation. How do we know that that fatigue was caused by atrial fibrillation versus another healthcare problem? One way to know how much the AFib itself is impacting your life is to perform a cardioversion. Now, if we cardiovert you, if we get you back into normal rhythm, and we see you back in the office a month later and you say, I feel significantly better, we have established that atrial fibrillation is indeed what's causing your fatigue, what's affecting your quality of life.